So, a question that I get very often in the consults is, what kind of dental jobs can I do while I'm in the NDEB process?
Okay, that's understandable. Everybody's
Yes.
interested into this.
Mm-hmm.
There are a lot of options which we can discuss now.
Yeah.
We can start with the least like hands-on
Mm-hmm.
involved one,
Right.
which is a floater.
Floater.
Do you know what that is?
No, I've never heard.
Well, okay. So it's you usually help at the back of the dental office. You don't interact with patients. You take care of the disinfecting of equipment. You take care of sterilizing instruments.
I thought that was something that the dental assistants would do.
They can also help with this, but sometimes they're busy helping with the patients. So some very busy
Oh, I
clinics,
see. I
they just
see.
need a person who can help
Right.
specifically just for instruments, because it's an ongoing process. It's
Yeah.
like a lot of volume.
Yeah,
so
for sure. So that's interesting. That's an interesting term to search for when you're looking for a job, because I didn't know about that. So a floater would be kind of like the person that mostly will take care of instruments, like
Yes.
disinfection, that kind of stuff.
Sterilization, yes, all of these.
That's interesting. That's good. One I can think of, and I never suggested this, so yeah, from now on, this is a good one. But one that I'm always like talking about or suggesting to people who are moving here is treatment coordinator.
This is a very good
Yeah.
option because it does not require any specific certification.
True.
Yeah,
Yeah.
it involves interacting with patients a lot to let them know what their treatment needs are, why they need them, and to also coordinate their treatment plans. Also, you might deal with booking appointments for them
Yeah.
according to this treatment plan. And also, you might need interact with insurance companies.
And help the patient understand their insurance policies and like.
The better options
Yeah.
for them, what they can use. Yeah,
That's a very interesting one. I love this profession because we don't have that back home in Brazil.
That's true. Yeah, we don't have it
Did
back
you?
home in Bulgaria too. Yeah.
So it's so like it makes so much sense to have one person to deal with that because
Everything is organized.
they have all the time to explain to the patients, like that's what they're being paid for, to explain to the patient their treatment options, like the financial part of it, everything, and book the appointments.
Yes, and to help them understand why they need this specific
Why they need it,
treatment.
yeah.
They
So
can
it's-
answer all these questions.
that's
And
a good
if you're a dentist, you have a lot of knowledge and a lot of like background to support all of these statements.
Yes, they prefer. I think they prefer dentists, like international dentists, for that
True.
position because they know
Yeah.
you will know the treatments, right?
Yeah,
So
and
it's just-
also if you're not sure how to approach it, there's some short-term courses that can help
didn't
you
know.
like build this structure better in your head, how to approach this.
interesting. Yeah.
They're usually for a couple of days, I believe.
Oh, really? That's,
Yeah, they're very like short ones.
Yeah, that's nice. Did you have treatment coordinators back in your country, Omar? You didn't? So yeah, that's something people might not know about. Right?
Yeah, it's
Yeah.
a good thing. Also, dental receptionist.
Reception, yeah.
It does not need any specific certification. However, experience, usually Canadian experience is a
Not
good
require,
asset.
but yeah, good asset.
Good
yeah.
asset because you need to deal a lot of with insurance companies. You need to send like pre-authorization forms.
Yes.
You need to interact a lot with them.
With the patients as well, like
With
knowing how to
patients.
interact and,
yeah, and you
more
take
the social
care
part, like phone, like, getting phone
more of the
calls.
communication part, which can also help you with one of your exams actually.
That is true.
Yeah,
The ASJ?
the SJ, yeah, it
Yeah.
can help you a lot to boost your knowledge and your self-confidence when you're going
With
to this
communication,
exam. Yes.
right? Can you explain just a little bit about the ASJ, just in case someone watching is not in that?
So the
step?
SJ exam is that communication part that we need to show the patient why they need the treatment, why it would benefit them, and how to implement this knowledge into their beliefs and to also respect their beliefs. So
Because I'm not in that stage yet, so you're going to explain to the patients what they need. So as a dentist, you're going to explain what they need. So kind of like the treatment coordinator.
yes,
Position.
that's a
Right?
very good training, let's say,
Yes.
for a future
So yeah,
exam.
dental reception and treatment coordination.
both of them.
can really help.
Yeah, this is a very good opportunity. And it also gives you an idea how the system works in Canada.
Yes.
So once you graduate, you already be familiar with what
Yeah.
to expect, how to deal with it.
100%, yeah, because I worked at a dental office for a short time, I think 3 months, but it was enough to see like how, you know, insurance works, how to communicate with the insurance companies, the patients, and everything. It really
It's a
gets very
fast-paced
good, fast-paced
environment,
Yeah.
like dental materials and teeth and like everything is the same, but this part is quite
This part
different
is
usually
different.
from like back home.
Yeah, same. For me, it was really different and really good to see, like, to, you know, be in that environment.
It helps a lot,
Just
yeah.
see how things
Also for
work.
dental receptionists, there are short-term courses as well,
Oh, I
which
didn't
can
know.
help you to. Usually, there are a couple of dental softwares that
Yes,
dental clinics
they
use. So these courses can introduce
To some
the
softwares,
basic
how it
knowledge of these softwares for you,
Yeah.
which is a good asset as well.
Yeah, for sure. Yeah, I see sometimes like those job positions they require, not always require, but they
Prefer if
prefer
you have
people
this
with some
yes.
experience with those softwares. Thank you, Omar. Yeah.
Yeah, so it's a good option too. Another thing that you can do, of course, is dental assisting.
Hmm.
There are two different levels here in Canada. One is level 1 and level 2. Do you know the difference between them?
So I thought the level 1 was the floater, kind of like the
Yeah.
floater that you described first. I thought they would only handle like disinfection, that kind of thing, and maybe assist side, you know.
Yeah, like
Little bit.
passing
Yeah,
instruments.
yeah.
They have mostly like out of mouth, out of the patient's mouth
Yeah.
duties.
Yeah.
However, level 2 assisting is when you're more involved with the patient. You can polish some teeth. You can
Really?
yeah, you can place rubber dams, remove
I
them.
thought
you
that was
take
for the
X-rays.
hygienist. Sorry.
Yeah,
I was
no.
like, oh, that's like when you're touching the patient. I thought that was hygienist.
No, in level 2, however, you need certification,
Oh,
but
okay, yeah,
you
yeah.
can be more involved than usually what people think back home for
Yeah,
dental assistants.
Yeah. But the level 1 are they sitting? Would they sit with the dentist and like help suction, or just pass
I'm not sure about the suctioning part because
so
it's
nothing that touches the patient. kind of.
yeah, it's more like passing instruments, like chair
Preparing
side,
the table.
preparing
like
the table, chair side assisting mostly. However, level 2 is more like patient involved,
Hands-on,
and, hands-on,
Right.
and you need certification usually for most of the provinces. It's
Right.
National Dental Assisting Examining Board, which it gives this certification. However, in Ontario, if you're foreign trained dentist, you need only HARP certification.
The HARP is for the X-rays, right?
The HARP certification helps you to get additional training with X-rays, and you can take them on your own. Because if you don't have this specific certification, you're not allowed to press the button.
Right. Even though we have the
Even though we have the
radiology,
training
we've had
back
it.
home. Yeah.
right.
This
So,
certification.
just summarizing, in Ontario, if you only have this, you're allowed to work as a level 2 dental assistant?
Most of the time, yes. It depends on the clinic, what they're looking for, but it's usually enough to start working as a level 2 dental assistant.
Right.
This certification can take from like a couple of weeks to finish up to a couple of months. There are different institutions that are providing this training. And you get the certificate right away and you can start the next day.
Yeah, that's good.
Yeah.
Yeah. Other than dental assisting, I think, lab technicians.
Lab technicians, if you have previous experience, it would
with
be
prosto, I guess.
with prosto, yeah, mostly.
or ortho, right? Like some of the labs.
But mostly it's prosto.
Mostly, I guess.
They're looking usually for previous experience. I don't think they are looking specifically for Canadian experience. So it's good asset again if you have this, if you're interested. And it's a well-paid job, actually. The other well-paid position is dental hygienist.
Yes, they're very well paid.
They're very well paid. However, you need like a longer certification. Like the process takes longer.
It's a college degree.
It is
isn't it?
yeah, it's a college degree. It's between 3 and like 1.5 years.
Yeah, I just learned about this last week here. Because I only knew about the 3 years course, so I never even considered, because 3 years, it's like, okay, it's kind of like
long.
going back to university. Like
It is. And
it's
you're
long.
not aiming towards dentistry, you're aiming in like a different
so
direction.
It's kind of like, if I go this path, would I even give up on, becoming a dentist? For myself, I mean, because they're well paid, right?
They
Dental
are well
hygiene,
paid.
Very
But
good.
a lot of people are trying to enroll into a hygienist position first, so they can
Fund the process.
fund the process, and then they can start going into the NDEB equivalency process. However, being a hygienist here does not help you anyhow to pass easily the NDEB
Yeah, it would actually,
certification process.
if you think about it, like it takes time from your preparations, right?
Yeah, it takes time and it takes a lot of dedication. It takes a lot of
Yeah.
like mental and physical.
Yeah. I know some dental hygienists, and they all work a lot. Like they're always like busy with patients, like from back to back.
Yeah, they are, because
Always
there's a lot of
Huge
need
demand,
For,
yeah.
huge demand for hygienists. However, if you want to devote yourself to this, it's also a good option.
It is, yeah. I mean,
But it might like harm your original
Preparation.
goal, and
yeah. That's
Might
what I
take
thought,
away
like
a
for
lot,
myself, because
yeah.
I didn't know about the 1.5. Maybe if I knew about the 1.5 year program, maybe I would have considered it.
But it also, you need to keep in mind that this 1.5 program is like very long and extensive in terms of like
In full time.
It's full time.
Yeah.
So you're not able to prepare yourself simultaneously
No,
for
yeah.
both of the processes.
Yeah, you
So you
wouldn't-
need to choose.
You would need to know that if you're doing this, your NDB process is going to be delayed.
It's going to be put on hold
Yeah.
for now. Yeah, it is a long process. However, some people might find it a good fit for them, because the NDB process is not easy to afford.
Yeah.
And being a hygienist can help you to fund the
Yeah.
whole journey.
Yeah, for sure. And it is the closest.
It is
I mean,
the closest
right?
thing that we can do here, yeah.
The most hands-on, again.
most
This
hands-on.
is the most hands-on, the closest, well-paid. So, yeah, I mean, it is an alternative.
It is an alternative. Also, as an alternative, you might have the option to go up north. Have you heard about this option?
I just heard about this. You're going to have to talk about this.
So if you want to be a dental assistant, but if you want also to devote more time for preparation for NDEB, you might travel up north, where it takes, let's say, for 3 to 4 weeks for you to work full-time there, but you're not bound to like a full-time contract or something. You can just like
occasional?
you can do it as an occasional thing, because they need a lot of help there. They need dentists. However, they need a lot of dental assistants.
Right.
So but it's actually way up north. It's like
I mean, to me, it sounds fun.
none of it.
I
and
like the cold. Like, I adapted really well to the cold here, even though I am from a tropical.
However, Toronto is like more of the milder
yeah,
winter.
like I am in the southernmost.
Yeah. So up
almost.
there, it's like usually very cold,
I know, it must
very
be
dark,
extreme.
very like it's up to the extreme part. But
I
it's
mean,
a good.
if it's like temporary,
It's temporary. It's a good option to
be in the
devote
field.
some time, be in the field, get some experience, and have enough time to prepare
Then come
yourself.
back.
And it's also a bit better paid than if
Than
you
here.
get a dental assistant position
Oh,
in
yeah, I
Toronto
bet.
or in a big city.
Yeah. And do you know if they pay for your like tickets, your
Yeah, they
like,
cover
travel
everything.
expenses?
They travel cover expenses. They give you some like food as stipend as well, and they cover your hotel, or if you're staying in a hut or somewhere. I mean, I've never been there.
This sounds so fun.
I've always wanted to go up there, so yeah.
Can we just plan and go? Like, let's
Yeah,
go.
Omar,
Let's do
here
it.
we go.
Omar, you can come with us. Let's all go. Yeah, we should all
Yeah, it sounds very interesting to me, because it's a like very unique
Yes.
experience.
Uh-huh.
And in the future, if you want to practice there as a dentist, it will give you like a good point of view if you really want to do
like,
this
It's experience in the area, right?
in the area. And I mean, you won't have all the responsibility. You're for the patients, right?
Yeah.
So if you go there as a dental assistant, it might help you to form a better point of view.
That was interesting because there's lots of options actually. Like
They
right?
are. If
But
you
people
think
just
about
don't
them.
know about them.
Yeah, so it's like always a good option to search with like keywords, to visit different websites that are offering job opportunities,
Yeah.
just to like ask
And
friends
look into
or
different
relatives.
provinces. Yeah.
Different provinces. It's wherever you are located. It's easier, of course, to get a job in a smaller city because the demand is
Yes.
higher than into like the bigger cities
Yeah.
are like oversaturated,
Oversaturated.
unfortunately. So if you move into the suburbs, it might
It'll be
also
easier to
help.
find.
Yeah, or in a smaller town, like a
Yeah.
couple of hours driving, something like this. This is
sure.
always like a better opportunity for you to find a better job, which could be also better paid, and
True.
your expenses will go like
decrease,
will
yeah, in
decrease.
those
So
places.
it's like there are
Yeah.
a lot of things to consider.
Yeah, for sure. That was good. Thank you for the information you shared
You're welcome.
today. It was fun, and I hope this helps in the future with my consults. I'm
Yeah,
gonna just-
hopefully, and we're always here to help people if they have any questions. We
Yeah.
can always guide them. We can help with whatever we
For
can.
sure, they can just book a consult. They can just book a consult, and we can help.
Yes.
Right. Thank you so much. This was fun.
Thank you.